sockets are here. These are the nerves for vision that go to the two eyeballs. And so you can see these blood vessels right here, as red. They have branches, which I'll show some of this stuff later, but it's all hidden within the folds of the brain. So one of the things that's important to keep in mind, which affects what we do, is that these blood vessels are not actually in the brain. They're in spaces that the brain has within the ridges. And so that enables us to do some of the things that we do. So this is the head flipped over, and the forehead bone, if you will, has been removed. So these are where the eyeballs are, and so this is the brain sac. So the brain floats in spinal fluid inside the brain sac. So when this is the meninges. So when it gets an infection, that's meningitis. It's illness of this tissue here. And so the our access for getting to aneurysms is by opening that up. So once we clear that away, that lining is right here underneath the skull. This is, again, looking at a person face on with the face removed. And so you can see a little bit more clearly where the back of the eyeballs are and the nerves, and where these blood vessels are located with respect to the nerves and then within the tissues of the brain itself. So this is a little bit of a magnified view just to show where these blood vessels live with respect to the inside of the skull. Because people will think, oh, I've got this aneurysm here is on my forehead, but it's actually oftentimes they're way in the inside. So they're deep inside in the center part of the head. So here are where the nerves are, and these are the blood vessels. Again, these are those nerves that take or that are go to the eyeballs on each side. So these are the vision nerves here. And so you can see where the most common location that aneurysms grow is in this region, is kind of sitting right over that nerve. So sometimes with an explosion of an aneurysm, that nerve can get damaged. Excuse me, this is another view, just a different angle where everything's been removed. So now we're actually looking at where the carotid artery enters the skull and inside of the skull space, so to speak. So this carotid artery is here. This is the right optic nerve. So this is the nerve of vision to the right eyeball. So the right eyeball is back where the mouse is beyond there is where the eye socket's located. And so this is looking at a person from above with, the brain removed. And again, this is where the artery is. So this artery can grow aneurysms right along here, little bumps on the blood vessel. And you can imagine the relationship that they would have to that nerve. And so that affects our decisions for what we can do for some aneurysms and what options are out there. So here's another view. This is the forehead is here. So the brain has been lifted, and we're looking at the underside of the brain surface. So the eyeballs are going to be way up here. The right one is here, and the left one is here. So this is the nerve for smell. It goes to the top of the sinuses behind the nose. Here are those nerves for vision again. So that picture I showed you that everything was removed, here's that carotid artery underneath there, and here's the nerve. So you can see it a little bit more clearly on this side, the artery right next to the nerve. And so this is these branch points where this blood vessel breaks off. These are the locations where aneurysms will commonly occur. So this is the nerve for vision, and so this is the other area that aneurysms can grow. Here's a cutaway of the brain itself. So we were over here earlier, and this is just to show what these blood vessels look like and how they actually get to the brain and what they do for the brain. Hey. And so this blood vessel here is one of the larger ones, and ultimately it's going to make its way into the brain, and that's how it delivers nourishment to the brain. Oops. So this is what they look like when they're up close. So those big arteries just branch off and get smaller and smaller, just like tree branches. And then they have small little blood vessels that go into the brain, and you can see where it's in the midst of the brain tissue. And here, it delivers nourishment to the brain. So if you get a blockage of that blood vessel, that's what a stroke is. So this closes off, and that part of the brain doesn't get nourishment. And unfortunately, it's all a matter of real estate. So it depends on what location is involved in what function. And if some damage occurs to that blood vessel, then it'll be a matter of what you lose. Yeah. So for example, if it's this blood vessel, that might get an area where you can't feel your arm on one side of the body. Or if it's this blood vessel, you may lose speech. So those are considerations for us as well. This is what the blood vessels, or what these are, I should say, what the blood vessels look like. So here's the blood vessel from a different view, and so it has all these little small branches that come off, and this is all that little nourishment that goes to different parts of the brain for function. So these are pretty important when we navigate blood vessels and want to not damage them. So obviously we can't just people aren't walking around with parts of their brains hanging out so we can just get to these blood vessels. So there has to be some way for us to see these. And so the way we do that is to get basically a study of plumbing. So just look at pipes. And so this is the way we do it. So here's that same view. There's that nerve I keep pointing out. This is going to the left eyeball. The brain's all been cut away. But here's the carotid artery as it comes up inside of the skull, and it splits off and gives off branches, and then it gives more and more branches out to here. So we go into the bloodstream and we inject dye and we film the dye as it travels through, and we make movies of the blood vessels. And so that's what we're looking at. This is the fancy medical term for this is a catheter angiogram. So cardiologists will also do this for the heart. They'll do angiograms. And so we can do the same thing for the blood vessels of the brain as well. And so this is the view that we're looking at when we do these angiograms. And this is what we are imagining in our heads is what this 2D picture is supposed to be in 3D. Excuse me. So here's a right-sided one. Here's a left-sided one. You can see all those small little blood vessels I was showing you that was delivering nourishment to the brain is all these small little guys right in here. So the left eyeball is about here. And the right eyeball is about here. And again, here are those little small blood vessels right there, these guys. So that's how we can see what's going on in there. But the other thing you can tell potentially or not is that we're just seeing what the inside of the blood vessel looks like. We can't tell anything about what the brain tissue itself, this gray stuff around it, is actually doing. So that's where other tests come into play, like this, an MRI. If you guys have ever seen an MRI, it gives us these kinds of pictures where we can see the ridges and folds of the brain, just like all those cadavers that I was just showing you. And so likewise, we can see the structures on the inside, and we can correlate that with what the blood vessels are. So in this MRI, we actually can see the brain very well, and you can just see the blood vessels, but they're just kind of these lines. They're not really sharply delineated. We can't see all those small little branches coming off. But this person got an MRI because they were having some memory loss, and it turns out that they saw this ball sitting here, right there in the middle. You guys can see that. So that turned out to be an aneurysm. And this is the view that we've got. So it's a slice away, or excuse me, it's a slice through this segment of the brain. So this ridge right here, or fold, is this one right down here. And so it happened to catch this segment of the blood vessel right in that region, and then this person had an aneurysm. So what an aneurysm is it looks like this. This is the blood vessel as it comes out, and you get a balloon that grows on it. Okay, this is a simple type of an aneurysm, so to speak. You can have much more complex, different shapes and things to them, but I'll keep this fairly straightforward. So an aneurysm that's got a circle like this, or this one, on the side of the blood vessel. So what it comes down to, and this is really the gist of the talk, the rest of the stuff is just neat stuff in the talk. So if you have a family member who has an aneurysm, it is possible that it can run in your families. So I have families who, there's 3 sisters who have aneurysms. Their mom had an aneurysm, grandma had an aneurysm, so it can be passed on. And so in those cases, when we find an aneurysm in a patient, then we'll give them letters that they can take to their doctors who can order scans, MRAs. So an MRI of the blood vessels called an MRA, MR angiogram. And it can screen for aneurysms. And so it can find up to sometimes a millimeter or 2 in size, a little balloon like that. And so that's a way to just check at least and be sure that you don't have one if your, for example, brother has one. But likewise, we don't always do something for every aneurysm that we find. Sometimes if an aneurysm is small and it's got a nice smooth round surface, we'll oftentimes just watch it. And the way we do that is that we'll get serial scans. So maybe we'll get another scan in 6 months, maybe we'll get one in a year. And it just depends on that person's history, their family history, and then their medical history too. So things that go into that are if they are smokers. So cigarette smoking has a higher risk of making an aneurysm grow and likewise popping. Or if you have high blood pressure that's poorly controlled, that is also something you can imagine, that pumping of blood up against this balloon's wall can make this water balloon pop. And so those are 2 of the common risk factors. And then there's other diseases that can cause aneurysms to grow and then likewise have higher chances of the aneurysms popping. So when you have a situation like that, then we'll also maybe have a little bit of a threshold for thinking of doing something versus just watching it for time being. And also when we watch it, it's a matter of whether the aneurysm is growing over time, because if it enlarges, now the worry is it's going to get bigger, just like a water balloon and pop. So then the next thing becomes doing something for it. How do we go about doing it? Well, there's two ways. We can go in the bloodstream all the way up, just like in those pictures I was showing you guys, and then basically put stuff in the aneurysm, which is this. These are coils. They fill it in so that blood cannot enter it anymore. And so if an aneurysm is filled with something other than blood, then it can't pop. That's the way it works, ideally. Or the other option is we make an incision on the scalp and an opening in the skull and go from the outside and put these little devices across the base of the aneurysm to close it so blood cannot enter anymore. And that's called a clipping, and this is called a coiling. So this is what a brain scan looks like after an aneurysm is ruptured, and you guys will probably just have to take my word for it that this is not good. So all of this pattern here, this bright white along here, it's kind of pentagon pattern. So this is a classic pattern on the undersurface of the brain. I don't have that picture here, where the aneurysm exploded, and when we see this pattern, our next step is to get a scan to see where an aneurysm is, because that's a very classic pattern for what it looks like. The fluid spaces in the brain in this person are also enlarged, so people use the term water on the brain. It's building up because of the blood that's in there. So we have to drain that because that's another culprit for coma. And so it's real important when this happens that, this is when people are coming to the hospital or EMS is picking them up. And so we want to control their blood pressure so that it's not high so it doesn't pop again. Because if an aneurysm re-ruptures, 70% of people die after it ruptures the second time. So if you have heard some person went for emergency surgery after an aneurysm ruptured, we can't reverse the explosion's effect. The damage is done. What we're trying to do is just not let it re-explode so that the person just doesn't die, basically, from that, to keep it very simple and blunt. Or if there's a lot of blood in there, we want to get in there and take the blood out so that we can just make some space for the brain that's supposed to be in the skull. So this is an example of that. So this is a CAT scan. The bright white is the skull. So this is looking at the person face on. This is the skull around here. These are the blood vessels in gray here, and you can see where there should be a line in the middle. It's shifted over. And the reason for that is because here's this balloon, this aneurysm exploded, and then there's all this blood around it that is taking up space inside of the skull. And so here's all of that blood from this guy right here. That balloon exploded, damaged all of the tissue around it, left that blood that's there. And so what we want to do is not let that explode again and also get the blood out of there to take the pressure off of the brain. But basically, when it exploded, the damage happened, unfortunately. Here's another example. This is, I've used this one because this, does it show? Yeah, I guess you can kind of see it. That there's kind of a Mickey Mouse looking ear, but you can see from this area, it looks like it exploded out. And that's exactly what happens when an aneurysm ruptures, that it just explodes outwards like this. And that explosion from here out, all of this is not supposed to be there. That's blood inside of the brain that we want to take out to relieve that pressure that's on the brain and potentially put a person in coma. But we also have to be careful because when we go to take that blood out, this thing can explode in our face. So these are some of the joys of what we do. Okay, so here's another view again of the undersurface of the brain. And again, this is when the blood after an aneurysm ruptures, it kind of takes on the folds and spaces of the brain. So we have sort of a composite view this way and have an idea of what's going on. So there's a coiling procedure, which is the one where we go inside of the bloodstream. We do an angiogram. And these procedures, basically, when we take care of an aneurysm this way, it's sort of a now you see it, now you don't. Because we have to inject dye in the bloodstream and we save that picture and then we're working off of that, sort of like a video game that we're navigating it. And so here's the goal. So here's this aneurysm. We go into it with little tiny catheters and wires, and then we fill it with these coils, this metal here, and we basically have it now closed off so that the blood will just continue on its way where it's supposed to go and not enter here anymore. So what we see is here's the aneurysm, this ball. So here's the blood flow is going to travel up this way into it, and then likewise upwards to the rest of the brain. So here, it's got some coils in it. It's partially filled, and then in the end, it's filled up. And when we inject the dye, now we don't see it at all. Okay? So this is what that aneurysm looks like, that ball right there. So we've made that go away. And the way we do that is with these we snake little tiny wires and tiny little tubes, catheters inside of these blood vessels, and we can navigate them around through whichever one that we want using different shaped devices, and they're made of different materials, ultimately going inside of the aneurysm so that we can fill it with stuff. This is what we put inside of aneurysms. These are coils, and they are very, very small. They're often made of platinum or some other materials that will induce clot to form. So it's not just the metal being in there is protecting the aneurysms. Actually, the metal goes in and it causes clots to form, and then the metal plus clot kind of seal off the aneurysm. And so you can imagine if this thing is inducing a clot to form in the bloodstream inside of this aneurysm, then, if it gets into the bloodstream, it can induce clots. So the risk of these procedures when we go in the bloodstream is stroke, because we can have clots form in the bloodstream, and then those clots can cause blockages in some of those blood vessels that I was showing you. So that's a risk with some of these procedures. Then the other thing is when we seal it from the inside, like so, we're counting on this coil mass plus clot to form. And so sometimes you can imagine if the clot goes away, the coils may shift a little bit and the aneurysms come back. So I will show you that as well. So those are coils. So how the heck do we see this stuff? So this is the way we do it. So we use X-ray beams, very, very controlled on a machine. It's a fancy machine. It's called fluoroscopy. And the way it works is the person's head will sit in this cradle. So this is looking at it from the side. So the head will sit here. You have a beam of, X-ray that gets shot through here, and it reaches this computer, basically, that processes it so that we can then see on the screen, you can see the skull and some blood vessels. Yeah, you can sort of see it. And then we stand here on the side and are basically either at the person's wrist or at their groin, and we're doing stuff up in their head. So it's all very finely controlled equipment, and this is what we're looking at. And so we can look from the side and from the front. So that's how this works. So we have a very big fancy room over here with this equipment, so we can do all of this here at Frederick South. And there's a whole gamut of technologies that have been developed over the last few years to take care of aneurysms. But this one is a stent. So these are the way the stents in the head look. They're a little bit different than the heart stents in that we use them as a scaffold. So it's like a chain link fence that'll create a wall for us to then get inside of this aneurysm that has this wide shape to fill with coils. And the coils will sit up against this wall and not go into the normal blood vessel and lead to a stroke. But you have to be on blood thinners for this for a period of time to help prevent clots from forming. Another thing we can do is we can go inside the aneurysm and open up this metallic balloon that'll help clots form inside of it to close it off as well. Or another one is this kind of stent, which is an even higher grade chain link fence that will induce clots to form outside of it here, but allow the blood to travel through. So there's a lot of different ways to take care of aneurysms through the bloodstream. So this is a lady who was in a low-speed car accident. We found that she had a bunch of blood in her CAT scan. She was a low-speed car accident, and the blood that she had that classic pentagon pattern. So now we got to find an aneurysm because something doesn't make sense with her story. So we did. This is the bloodstream. This is a carotid artery. This is where it's branching off here, and it branches off to this blood vessel and this blood vessel. And then there's all this extra gnarliness that looks terrible and isn't good. So this is one aneurysm that ruptured. And it turns out she had another one right here. So here's a blood vessel that branches off here, and there's another balloon right there in the middle of it. So she had multiple aneurysms. We make this fancy 3D picture. That smaller aneurysm on the side is this bump right here. Okay. And then the ugly one you can see is this, and then it has another growth, or like a horn that's come out of it. So it exploded from the tip of this thing. So when we see, so if I happen to have seen this patient in clinic and she just happened to get that scan for memory loss and she had this thing in her head, well, we wouldn't even wait to say, let's watch this. This has an abnormal shape. This area that's grown out is thinner than the rest of this balloon. So this is just waiting to pop. So we want to take care of this very quickly before it causes potential devastation. So again, the way we do this, we go inside of the bloodstream with this wire all the way up, and into the aneurysm, and then we filled it with metal. You can sort of see the loops in there of the coils. And ultimately, this is kind of midway through us filling it with coils. And by the time we were done, you can see it's like this now you see it, now you don't thing, where it's basically gone. The coils are sitting where the aneurysm was. And then we still have this other aneurysm. So what do you guys think we should? Oh, yeah, she had another aneurysm on the other side too. So this lady had 3 aneurysms. So what should we do about those other aneurysms? There's no wrong answer. What? Fill them? Yeah. So usually we don't at the same time because every blood vessel that we go into has a risk of us causing a clot to form. So we just want to take care of the main thing that's the problem. And then now they have to recover from the rupture, the bleed that they had. So oftentimes we'll wait, and then we'll come and take care of these later. So this lady ended up getting 2 surgeries then later to take care of each aneurysm on each side. And that just has to do with the particular shape of the aneurysm. Okay, so when we make the clipping picture that I showed earlier, this is what the clips look like. They come in all kinds of different shapes and sorry, I should pause. Now we're going to be making a cut in the head going inside of the skull and going to the aneurysm. And so this is the equipment for that. This is not with the x-ray machine and dye. So what we do is we get to this balloon basically, and what we want to do is we want to pinch it closed. So this is these are what clips look like. They come in different shapes and sizes. You can see it's open here, and then when it's closed, it's like that. So we want to get the aneurysm in the midst of it and pinch it shut. And then this is a little device that we use. It's called a clip applier. It's an instrument that we use to be able to get kind of deep into the brain without sticking our knuckles in there, which is usually not preferred. Okay, so these are different ways that we can use these clips. So this is the main blood vessel, and it's branching here, and then you've got the balloon right there. So this aneurysm's been closed off in this direction. This one has a different combination of clips to get it closed off. So the goal is that the main blood vessels themselves maintain normal blood flow, but that the aneurysm is gone. And so there's all these different ways of doing this. So when we do the surgery, I showed you the other one, the angio has that machine with the x-rays. When we do these surgeries and we make an opening in the skull, my eyes aren't that strong. Most people's aren't either. So we use the microscope, and this is a magnifying device. And so this is surgeons seated at the microscope. So it's got eyepieces here. It magnifies through here, and it's a light through this working corridor that we have here. And then this is the screen that everybody can see what we're doing. And this is the assistant on the side who can, give a hand or do something else. And the screen here is so that the person who's helping with surgery can actually see and know what instruments to give you, because when you're looking under this magnified thing, you can't look away. Okay, so how do we go about getting into the head? So these are some old pictures. You guys are okay with seeing blood? Or I guess the online people, if they have a choice or not, just a heads up. It's not going to be terribly gory, at least I don't think. Anyway, so the way it works is we oftentimes will put the heads in fixation so it doesn't move. This is where the incision is and behind the hairline. So once the hair grows back, it's nice and hidden. And then we basically go through the layers of the skin and the muscle through here to get to the skull and pull everything forward. This is the muscle being pulled forward. And then we make some holes in the bone. We connect the dots with a drill. This is all done with a drill. And then that gets us access to the brain sac that I was showing you. Then we kind of move the brain sac aside, make some more space for ourselves, and then open up the brain sac here so that we're looking at the brain tissue itself to then get deep into those folds of the brain where those blood vessels are located. Excuse me, and which is where the aneurysms are located. So what that looks like, is this is one fold of the brain or a lobe of the brain. This is another lobe. The eye socket is back inside of here. So we're looking at a person from the left side. And so essentially we have veins, which are blue, and we have these arteries, which deliver blood to the brain. These take blood flow away from it. What we want to do is we want to get deep inside this fold. And so we basically go about dissecting that to get to where the arteries on the inside are located. Again, here's where the eye socket is. This is a lobe of the brain, another lobe, and so all the blood vessels are there. And this is what it looks like when it's magnified. So on one of those pictures that I was showing you where there was 3 branches coming off, this is what it looks like when you dissect it out. So these are all blood vessels that are delivering blood and nourishment to important parts of the brain. So this is what it actually looks like on a person. So here's the incision behind the hairline. This device is the pin device that we use to hold the head in place so that it doesn't move. You don't want something moving. By the way, most aneurysms, the sizes are like 4 or 5 millimeters, 2 millimeters. A giant aneurysm is considered 2.5 centimeters. So the scale we're talking about is really, really small, which is why a microscope is helpful. And so what we do is we make this incision, go down to the skull, kind of pull everything in the forehead forward, and now we're just looking at the skull with the the tissues deep to it protected. Then we make some holes, burr holes, if you guys have heard that term, in the bone itself, and then we do a connect the dots with this drill over here, which is going to come around and make these cuts, and then we're looking at this brain sac underneath it, or the meninges. And so then what we do is we want to open that up, so now we're looking at the surface of the brain. So we've gotten that exposed, and now we're going to go into this corridor here to get between those folds of the brain to go to where those blood vessels are located. This is what it looks like in surgery. With a little bit of a different picture. So this is where the incision is behind the hairline. This is a different type of a device holding the head in. There's the microscope back there. And after we've kind of pulled everything open, this is the right side, so the forehead's been pulled forward. Then I've made this opening here in the skull. This is all the different equipment that we use for this type of a surgery. Now we have an opening where we got this skull opening here. It's just behind the top of your eyebrow. So the brain sac has been open. You can't see the brain over here because I have it protected and covered so that we don't hurt it or injure it. And now we're going to slide underneath the surface of the brain here to get to where those arteries are located. The difference between this picture and how nice the brain looks versus this picture where it's red and angry, or like this one where it's red and black in here, this is after the aneurysms exploded. So that's what a ruptured, post-aneurysm rupture brain looks like. It is not a good situation to be in. Surgery with this is difficult because the brain is just raw and angry, versus the other one, which is nice and more delicate. So, but it's the same process. Sometimes when we open, there's a big clot sitting on top of the brain that's like jelly. And so once we take this away, you have this underneath it in this particular case. So that's what it looks like. So this one was a swollen brain. So we have half of the head, half of the skull we've removed to make space there. Okay, this is going to be a video of surgery. So if you guys are leery, then I don't know, heads up. So this is a person whose aneurysm ruptured. And this blood over here is the blood like I showed you guys earlier, and the fluid spaces in the brain are swollen. Her aneurysm is this whole thing. This one was, I think, 16 or 18 millimeters in size, so quite large. And so she came to us pretty darn sick. And so now we want this big thing to not explode again so that she doesn't have a bad problem happen. So we did one of these fancy 3D pictures with the angio, and this is what we got. So it's a pretty complex balloon. And the reason I say that is because it's not just one balloon on the side of the blood vessel. It actually had blood vessels coming out of it too. So it's got two blood vessels here, another one over here, and all of these are delivering nourishment to important parts of the brain. So we can't lose those. So we can't just come and put a clip right across here to close this off, because then those parts of the brain won't get nourishment. So it gets complicated. Okay, so where we, just to orient you guys, it's in this video that's up next. So this is the right side we'll be showing you. Her aneurysm was located right here. So the way we get to it is we make an opening in the skull here from the side. This brain that's been removed, this one's kind of lifted up and this one's moved down to get into this fold here where these blood vessels are located, and then kind of work around it. Okay, so this is the aneurysm. That top part of the brain is on this side. The other part of the brain is on the other side. And it's actually projecting pretty well. So you can see it's pulsating once I leave it alone. And you can see blood swirling around inside of it. So there's one of the blood vessels coming out of it. So now I'm working towards that other blood vessel that's going into it, because what I want to do is stop the blood flow that's going into this to basically clear, to find all of the blood vessels. And there you can see it's pulsating. You can sort of see the blood swirling around. So this is the view from the microscope. Excuse me. So we're going to close down this blood vessel here to stop the flow going into it. And then those other blood vessels have some flow coming back too. So we're going to close those off as well with these clip devices. There's already one in place right here. Sorry. And what it'll do is it'll soften up this aneurysm so that when I go to kind of find those other blood vessels, it doesn't, basically it doesn't explode. So there's a clip there that's going to go on the main pipe going to it, and we're going to pause blood flow going into the aneurysm. Excuse me. But it's still fairly full because the other blood vessels are also bringing blood to it. So what we're going to do now is find those other guys and close them off too. So these are some additional clips going in there. So we're going to, I think, end up closing all of them down. So the other thing too is you guys have heard that expression, time is brain. So like this blood vessel down here that we just put a clip on, that's sending blood to the movement part of her brain. So, now that part of the brain is not getting blood flow. So now we start counting down for how much time we have to be able to do all the stuff we need to do, and ideally get the aneurysm closed off and then reestablish blood flow so the person doesn't have a stroke. Okay, so now it's a little bit softer, so I can move it around a bit. And there's another blood vessel out here somewhere. Yeah, I'm going to jump ahead a little bit. By the way, all this stuff here, these are little wisps of fabric, basically, with strings on them that we can remove, and the brain around it is all covered and protected. So these are just, I'm just dissecting away some of the clot after the aneurysm had ruptured to find some other blood vessels that are coming off of this aneurysm. So I think we put a clip on this one too. Oh no, that's just crud. Oops, sorry. Yeah, so I found another blood vessel here. So we closed it off, and now this thing still has a little bit of flow going into it. So it's not as soft as ideally would like it. But what I want to do now is recreate where the path of blood flow is going to come in from this blood vessel here, and then exit into those blood vessels on this side as well as this blood vessel here by making a channel through the middle of all this tissue, and make the majority of the aneurysm tissue go away as much as that's possible. So there, I think I found another blood vessel there. We're going to close that down. And you can see this thing is much softer. It's not pulsating as much. So now I want to just be able to see the tissue around it because this hulking thing is taking up space. So we're going to shrink it. Now poke it with a needle. And then we're going to suction that blood out, and it's going to shrivel up. There. So now the balloon's deflated. And now it's just making this pathway for the blood to come up and go out into each of those branches. And so it's just going to be a series of these little clips lined up. And this method of doing it is called a picket fence. And you'll see why here in a minute. You can see the aneurysm still alive. There's still blood flow going to it, but it's nowhere near as much as it used to be. So the goal here is to recreate the blood flow, or allow this channel of blood to travel from the inside through here and find its way out to this blood flow vessel back here and the others back here. So I'm just going to jump through this. So these all get lined up and stacked in this manner. So here's this lineup of clips, this picket fence, and this is the corridor that I've created for the blood to travel through. So now we have to go about letting the brain get blood flow again. So now we're going to take those clips off. Those are temporary clips that arrested flow. So some of those clips are coming off. And then ultimately we're going to take the main one that we put on first off, and then you'll see this come back to life a little bit more. So again, here are those blood vessels with flow that we want to be maintained so everything works. So here comes this last clip, and now it's going to inflate. There it goes. So now it's alive again. So we take that out. This is blood flow coming into it, traveling through these branches, and then another branch back behind it. So we have this corridor for blood to go through. So that got the aneurysm closed off to some degree, although that tissue is not normal. And so we got a scan afterwards. This is what it looked like. These are all those clips, all of this metal in there. And then that pathway that we made is this right here, just that little pathway. And if you remember, it used to be that big. So now there's a little pathway right through here that allows flow to go through these blood vessels. So that's called a clipping. So we put it all back in there. We put her skull back in place, and so she did well. This is another aneurysm. I'm going to jump ahead so you can see this pulsation, but here's this balloon here on the side of the blood vessel. This is just a device for measuring blood flow, but ultimately we'll end up closing that off. But this is what the brain tissue itself looks like under the microscope when it's magnified. All right, I think probably the last one I'll show. Oh yeah, we can also do this by making incisions in the eyebrow only to make the same exposure. So a little incision in the eyebrow, make an opening in the skull. So here's the skull. The eyebrow's been pulled forward, so the nose is here. This is the bone here. We're going to make an opening in the skull, and that'll let us see all the way down to where that nerve was and put some clips through there through that small little opening. So that's another way to get to these aneurysms. If you guys remember, I mentioned that you can have these aneurysms where we put coils in them and they can regrow and come back. So this is an example of that. So similar to that lady, you can see she's got this ugly thing here in the middle. And this exploded. This had ruptured. So she came to us as a rupture. She got, and the aneurysm's located right here, right in between those two nerves. And, well, there's the aneurysm. So it got coiled. And when she came back for follow-up, so these are all the coils inside of that aneurysm. And when she came back for follow-up, I think that's the next slide. Yeah, when she came back, this area right here, it's pretty subtle. You can see it on this. You can see it on the screen. So we want to see the coils right up against here, so it looks like nothing else is coming in. But there's this region right here that regrew. So aneurysm recurred. So we have to do follow-ups on aneurysms when we put stuff inside of them because this can happen. And up to about 20% of the time, it grows enough that we have to do another procedure to get that area closed off. And so we can put more coils in or some other device through the bloodstream and go inside, or we can come from the outside. Actually, this video, this lady's, I think was through the eyebrow, was an incision through her eyebrow, basically, that'll give us a corridor to come in like that. And basically go to this area where her aneurysm is located right between these two nerves and then pinch that one closed. So that's what we're looking at here. So it's the right side. This is her right optic nerve. So this is vision to her right eye. This is vision to her left eye. So if we screw her around, she's lost vision. Here are the coils. Is that sound playing? So what we are looking at is, sorry, let me reorient you guys. Okay, this is a retractor blade, just kind of helping keep the brain to the side. So that blood vessel area that's come back is this one right here, okay? Here are those coils. This is what they actually look like. And they have migrated outwards, and they're sitting between her left nerve and her right optic nerve. So now this is the area where it's regrowing. You can see it's kind of grown into the nerve too, but hasn't caused any symptoms. So we're going to go and pinch that area closed with these clips. And so that'll, well, let's close that down. Now I have to be sure, and this device is an ultrasound, so it's I can hear the pulsation of blood through the blood vessel. I want to be sure that this did not clamp down on the blood vessel and limit flow to the rest of her brain. And then the other way we do that is we can inject some dye, and a filter will allow us to see the blood flow as this dye comes through. If this plays. So what we're going to see, no, my battery went now. I have my thing, but any questions? Do you guys want to see that? Yes, they do. Yeah, that's a great question. Yeah, so there was the gold clips that I had put in there initially and took out. They have less pressure because we don't want the normal tissues, the normal blood vessels, to get crushed. Because, well, if they do, then that vessel is destroyed, and then that can lead to a stroke. And the more permanent clips have a higher closing pressure so that the aneurysm doesn't come back. This thing will work. You think this one's connected, Quinn, or no? Or should I just go to the wall? Are you going directly into the wall? Yeah. Is it up? There it is. Yeah. So what we're going to be seeing here as that filter on the microscope comes in is going to be the blood flowing through this blood vessel, out this blood vessel, out this blood vessel, nothing going into here. We want to be sure this is dead, that this aneurysm is not going to come back. So then it goes black, and again, we want to see sort of a curve of blood as that dye comes in. So there's a filter on the microscope, and then I inspect that area so we can see that we've got good flow in this blood vessel, the opposing blood vessel, and that area where those clips were located, may have to take my word for it, is over here, and we see that it's dark. We don't have any dye traveling into there. And so here's good pipe. So that's a good result that we've got with that aneurysm closed off. And this is just checking to be sure. And this is, again, what it looks like. So these are those coils. That's the optic nerve on the left, on the right side. Here's one blood. This is the blood vessel that moves, or that goes to the part of her brain that moves her left leg, or right leg, I'm sorry. And this is the one that moves her left leg. So if those get closed off, you got a bad day. We don't close them off, by the way, just so you know. The job is to be sure that it's not closed off. And then working around those nerves. Yeah, and then this is what the final view looks like. I think that's it. Oh, yeah, this is a little bit more of a complex case. I can stop there. Questions? Yeah.
If you've got a large aneurysm coming off the circle of Willis,
Yeah.
you treat that the same way as you would a small aneurysm that's anterior vessels.
Yeah, so actually that's a great question because I'll show you the circle of Willis. It is in these heads. Oops. Yeah, so the circle of Willis is it's right here. So this little blood vessel connects the left and right in the front. This guy here, this is one of them that connects the back to the front to the back, the carotid artery to the back. And then this is another part of the circle. So basically from here, the blood can sort of wrap around and go across this bridge here, and then the other blood vessel here. So that's a circle. So the aneurysms are commonly located off of this branch or off of this branch here. So, we sneak in all the way through that corridor to those aneurysms here. And then that large aneurysm I was showing you, it's out here at another branch point. So in terms of the devices that we have and how we treat them, yeah, it's the same. Now, you said a large aneurysm or a small, like 2-3 millimeter one? A large one, yeah. So, You can, yeah, and many places do. So they don't. All places don't have neurosurgeons anymore who just take care of aneurysms. So you have folks who can't open the head up and do the clipping, and in fact, a lot of people do the coiling much more than clipping. It's the newer technology, but it's got the downside that the stroke risk is a little bit higher, and the aneurysm can come back. But yes, you can coil large aneurysms, and then there's these other devices that exist now too that we can use that can sometimes indirectly make the aneurysm thrombose close off, like those stent devices that I was showing you guys. And then the downside is if you have a large coil, that takes up space. And then that large coil, if the aneurysm comes back, now you have a big, heavy piece of metal of coil plus more aneurysm that's regrown. So those cases become more difficult to take care of later to make the aneurysms fully go away, because that's ultimately what we want, is we want aneurysms to be gone. Yeah. Okay. Any other?
So generally, if it's like a coil that regrows and you clip it, you leave the coil in.
If it's a coil and yes, usually we leave it in, yeah, because even though you just see some loops of it, there's a ton of loops in there. So you're pulling and pulling and pulling and pulling, and then that's scarred into tissue there, so it can damage tissue as you start pulling those coils out. But sometimes there's not enough space to put a clip, and so sometimes you kind of cut into the aneurysm, pull some coils out just to make enough space to then pinch it closed. Mm-hmm. Okay. So. Do I have to do anything else? Just close it out? Okay, excellent, good. Yeah, thank you guys.